Hello everyone, it's Peter Vujis again, physiotherapist at Axon Sport Physio. Today I'd like to talk to you about something that's really important in the management of lung disease and maximizing lung health. And I wish to talk to you about a couple of strategies to maximize your lungs. The first strategy is all about knowing how your diaphragm works. Your diaphragm is your main respiratory muscle just below your rib cage. Every time your diaphragm goes down, it tends to push your tummy out and it helps bring the air into your lungs, especially to the farther distal areas of your lungs, also called the alveoli. A lot has to do with the mechanics of the breathing. It's not an easy thing to learn. My wife, who has asthma, sits in front of the computer. She's working at home right now with the whole COVID business taking place, and she often has poor posture, breathes very shallow, and doesn't allow herself to take that deep inspiration. And then when she has to move quickly, she actually feels short of breath. So I'm always telling her and directing her, I just can't help myself being a physio. I tell her to bring back your shoulders, take a deep breath, lower your diaphragm, feel the air going into the lungs. Give it time to take the deep breath in. You don't need to do many deep breaths. You need to do the good ones. It's good to do it with somebody, a partner, so they can see what you're doing. It works always better to have a professional assess your capacity and how you're breathing. Does your diaphragm work well? Do the little muscles between the ribs work well, such as the intercostals? Are they working efficiently? Are you using mostly your shoulders? Are there other predisposing factors in your lung history? Were you a smoker? Did you have emphysema? Did you have asthma? So these are important things to take into account when we're teaching how to take a deep breath and really get the ventilation in your lungs. The second type of strategy we try to use, there's often people who have the shortness of breath. So what we teach in physiotherapy and at Axon Sport Physio, pursed lip breathing. Very simple, but again, it's a technique that needs a little bit of training. So you take a deep breath in, you pucker up a little bit like you're blowing into a straw, where you blow, and you blow out. If you're short of breath, you may have done it just at some point when you were running and you were trying to catch your breath and you're going. So this is called pursed lip breathing. So diaphragmatic breathing, pursed lip breathing, simple, needs a little bit of training, can be done with a partner and with the supervision of, very important to do it with the supervision of a health professional. You can always reach me at pivavujis@axonsportphysio.com. My phone number is 514-515-5998. I will be very pleased to answer any of your questions, any of your queries, any of your concerns. Again, I'm Peter Vujis, physiotherapist. Let's work together.